you doing today? My name is Janet Franks, and I'm here to talk to you today about mindfulness. Mindfulness is a tool that caregivers of adults with dementia and as well as the patient that has dementia can both use to control their stress, focus their day, and work through some daily issues. Let me give you some tips on this. So mindfulness is a way to bring your focus into the now. It's not to think about the past. It's not to think about the future. It's to think about the present moment. So here's some tips that we're going to do. So first of all, you need to find a very comfortable spot. Maybe your favorite couch, your favorite chair, the porch. Right now I'm in my office all by myself. So there can be quiet spots everywhere. So what you do is you just kind of get yourself comfortable. And I'm going to teach you two techniques. One is a breathing technique. The breathing technique is a way to just settle the breathing. So we're going to do this. You're going to breathe in and then out for like 10 times. Just in and out. Now another technique is to count. We'll use the term count to 10. So that would be slowly. Bring yourself to a calm moment. And let's count backwards first. 10. Now, you might want to close your eyes. You might not want to close your eyes. For this purpose, I'm going to go ahead and close my eyes. 10, 9, 8. Now I'm going a little bit fast. So you're going to want to do it a little slower. You can tell that I've had a fast-paced day and I need to slow myself down. So sometimes that can happen. Let's try it again. Breathe in, breathe out. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now in between that time, I did take a breath because even though you're counting and your mind is saying slow down, sometimes your breathing can help force your whole self to slow down. Now flip side, you can count up to 10. We won't do that, but you can use the same technique by counting up and just breathing. So it gives you kind of a start and end point. Here's another tip. This is more of a repetitive motion with wording. Now this is a Buddhist technique that has been around for years, and this is kind of a newer thing, bringing it to the dementia population, patients with severe dementia, mild, moderate, are really showing benefits with this technique. It's bringing their cognitive health back, and it's increasing their focus, and it's reducing their stress level. It's also used for caregivers of persons with dementia, Alzheimer's, and I say both of those separately because it's a different range. You think of Alzheimer's as being very severe, and then dementia just kind of showing some slower signs of memory loss. So it doesn't really matter where you are on that scale. You can tailor your activities down. So this one thing that I want to talk to you about is called a repetitive statement. The statement is sa, ta, na, ma. Satanama. Now, you can add another statement if you want to. The idea is that you're going to breathe and relax and just use that repetitive motion within the wording to calm yourself. Sa, ta, ma, na. See, I even mixed up the wording. It still works. Here's another thing. If you want to do a repetitive word, you can also take your fingers, and what it's called is finger tapping. So you're going to finger tap each finger to the thumb. Sounds very basic, but it's kind of hard to even tell you about it and do it at the same time. So the idea is, if you want to just touch your fingers slowly, you can just be thinking about that and practicing. If you want to add the repetitive words, sa, ta, na, ma. Takes a little practice. So between the breathing exercises, the counting, the physical touch with the finger tapping, the repetitive statements, those are some good techniques. Then again, it might be that you just need to sit. You just need to sit quietly. You need to listen to music. You need to turn off the TV. Of course, if you're at the beach, you have to sit by the beach and look at the ocean. That's mandatory. That's not always the option, especially with persons with dementia and Alzheimer's. They're usually in a facility. So the good thing about this technique is that it can be done with other people. Once you get past the embarrassment moment of finger tapping in front of others, because that can kind of seem kind of odd, especially when you're an older adult, to ask them to stop and sit down and tap their fingers. They might want to rush through it. But if you keep practicing, then you can encourage their hearts to look around and see that you're not the only one in the circle that's tapping your fingers. So it's okay. So an environment that is accepting and supportive is very, very important. Music I want to touch on because music and mindfulness is very important. What your favorite song is might not be my favorite song. And what your favorite song is might not be a good song for someone else to relax by. There may be some adults with dementia that need to listen to the oldies, need to listen to 20s music, need to listen to jazz or the blues or even country. Old country, probably, but maybe some new country or just jazz or just Lawrence Welk. Now, if you're a caregiver, you might need a little Michael Jackson. It's okay. It's okay to listen to different kinds of music. The idea is that you bring your focus to the now. You bring your focus not to think about the past and not to think about the future, but you're eliminating that stress by just bringing yourself to the present moment. So give this a practice. Again, I will say this has been very beneficial for caregivers to reduce that stress, because caring for loved ones at home with dementia, early Alzheimer's, or even advanced Alzheimer's, it's very, very difficult. So to stop in the day and to relax can be done anywhere. It can be done while you're folding the laundry. It can be done while you're walking. Now, there we go. Walking and mind focus might be a hard thing. So you'll probably have to put the phone up and not do Facebook at the same time. But that's okay. Again, if you'll bring your focus to the here and now, that's what we're talking about. I hope this works for you. And again,